How do I know if I have a kidney stone? Before we begin, let's meet Alice, a 30-year-old female who leads a healthy lifestyle. She follows a high-protein diet consisting of a lot of meats, dairy products, and legumes, and her water intake is adequate. One day, Alice wakes up with a sudden sharp pain in her lower left abdomen. She doesn't think much of it because the pain seemed to go away quickly. She goes about her day normally, but she realizes that she needs to urinate more often and feels a burning sensation whenever she does, even though there hasn't been a change to her diet and water intake. Alice suspects this may be a urinary tract infection, or UTI, since she has a history of UTIs, but decides to visit the doctor when the pain becomes unbearable. Her doctor suggests a urine analysis and a urine culture test to check for any white blood cells or bacteria, all of which point towards a UTI. However, to their surprise, her white blood cell count came back normal and there was no bacteria present. Instead, her doctor notices that there is an abnormal level of minerals in her urine. Specifically, her calcium levels are high. Suspicious of a kidney stone, her doctor orders blood work to check for markers of kidney stones and overall kidney health, as well as an ultrasound to see if any stones can be seen. Days go by as Alice awaits her test results. Finally, her doctor gives her a call to come into the office to look over her results. Alice's doctor tells her that she has a large kidney stone formed in her left kidney, similar to the size of a golf ball, which is considered a large kidney stone. There are different kinds of stones that can form in your kidneys, such as calcium stones, uric acid stones, struvite stones, or cystine stones. For Alice, the stone that is forming in her kidney is a calcium stone. Alice is frantic and confused, and she has no idea what this means for her. Her doctor explains the pathophysiology of kidney stones and her treatment options, reassuring her that kidney stones are treatable. Before getting into what kidney stones are, it's important that Alice understands why they are a concern. To do this, she needs an understanding of the urinary system. The urinary system, or the urinary tract, is composed of two kidneys, each with a ureter connecting to the bladder, as well as the urethra. The purpose of the urinary tract is to filter blood and turn waste products into urine to expel. Once the kidney filters your blood, removing any waste products as urine, it exits through the ureters into your bladder where the urine is held. Moving on to answer the question of what a kidney stone is, kidney stones are crystal-like structures that form in your kidney due to a high concentration of waste products in comparison to the liquid it's dissolved in. When there are a high concentration of waste products like calcium, oxalate, and or uric acid in your kidney with little liquid to dissolve it, it becomes an ideal environment for crystals to form. The crystal-like structure can pass through your ureters into your bladder and get expelled through the urethra. However, when it's passing through, there is a risk of it getting stuck in any part of your urinary tract, especially the ureters, which is a tube between the kidney and the bladder. It is more likely to get stuck and cause pain the larger the stone is. It is important for the doctor to figure out the size, shape, and position of the kidney stone to determine what course of action is needed to be taken to treat it. There are a number of things that Alice could do to treat her kidney stones. However, first things first is to control the pain by prescribing her a non-steroidal anti-inflammatory drug, otherwise known as NSAIDs, which is a drug that relieves pain, just like Advil. After this, the doctor could prescribe Alice with different drug treatments that could help treat the stones. Thiazide diuretics reduce the amount of calcium in the urine, a key ingredient found in kidney stones, and prevents the formation of new kidney stones. Allopurinol is a drug that reduces urinary uric acid and recurring stones as well. Urinary uric acid is yet another component of kidney stones. Finally, Alice could be prescribed potassium citrate, which increases citric acid in the urine. Citric acid prevents the calcium in the urine from clumping together and crystallizing, preventing kidney stones. These treatments are all used to prevent the growth and formation of new kidney stones to allow the stones to spontaneously pass. If the drugs don't seem to be working, Alice could also participate in medical expulsive therapy using alpha blockers that help with spontaneous passage of kidney stones and reduces pain. The doctor also explains a different route that Alice could take, which is surgery. Alice could undergo an extracorporeal shockwave lithotripsy. This procedure involves using high-energy shock waves pointed towards the kidney stone to shatter them. This is a non-invasive procedure that doesn't require inserting a metal instrument into the body. Another treatment option includes the ureteroscopic stone fragmentation and retrieval procedure. This operation uses an endoscope that is passed through the urethra and to the ureter and kidney to reach the kidney stones. The endoscope allows us to see the kidneys and pinpoint the kidney stone. Different surgical instruments can then be brought to the stone to break them apart and retrieve them. Finally, there is also the percutaneous nephrolithotomy. This is similar to the ureteroscopic stone fragmentation procedure, but this time, a nephroscope passes directly through the skin and body to take out the kidney stones. This is one of the most invasive treatments. After much discussion, Alice decides to undergo an extracorporeal shockwave lithotripsy. This is the least invasive and is the most common kidney stone removal procedure. Alice is put under deep sedation or general anesthesia during the operation. After the procedure, Alice is monitored for up to 3 months using X-ray imaging of her abdominal area. The treatment has a 50 to 80% success rate and may also reduce the kidney stone size so small that it becomes painlessly passable. All kidney stone patients are recommended to modify their lifestyles. This could mean drinking more water, maintaining a balanced diet with enough calcium, eating less meat and sodium, avoiding eating too much food, and eating more vegetables. There are also follow-up image screening and other tests that are done to monitor the stones and look at growth and potential infection or obstruction. In Alice's case, her doctor advises her to reduce her protein intake since high-protein diets led to the increased calcium and decreased citrate in the urine. She is also advised to increase her water intake. Disclaimer: this video is meant for educational purposes only and should not be used to self-diagnose kidney stones. Please consult your healthcare provider for a definitive diagnosis if you feel you are experiencing any symptoms mentioned in this video. If after watching this video you still have some unanswered questions or want to learn more about kidney stones, we have linked in the description additional resources, including the National Kidney Association, as well as an additional video explaining the causes of kidney stones.